MIPS Measure 226, Tobacco Use Screening. This is a telehealth eligible measure. It is also a counseling measure, meaning the provider must document the date that the patient was counseled in order to receive credit for this measure. In this measure, patients 18 years old and older are screened for tobacco use one or more times each reporting period, which is a calendar year, and receive cessation intervention if they are identified as a current tobacco user. The counseling can be done on the day of the screening or sometime in the previous 12 months. The workflow for this starts in social history. Tobacco questions and exclusions are going to be answered here. So you're going to open social history. And in order not to lose the information that previous providers have sharing in this section, we're going to click on Social History SMG. That will upload all the previously entered information about the patient. Then we're going to go down below to tobacco use, where we can answer the questions that we're asking the patient today. So at this point, the MA can ask the questions here. Are you a current everyday tobacco user? This includes both smoking and smokeless tobacco. If the answer is never smoked, you do not need to go any further. If the patient is a current everyday or current someday smoker, you're going to get further information about the quantity of use. At this point, after asking this last patient, we're getting to the counseling question. At this point, the assistant or MA needs to stop and leave the rest of this measure for the provider. Once the provider has counseled the patient about the dangers and risks of tobacco use, he or she can click in here and select today's date, which is the date of that the counseling was performed. Once this is put in, social history is verified, and the measure is met for this year. Like other measures, this measure has exclusion options. If you are unable to counsel the patient or ask the patient about tobacco use because they're too sick or there is a significant communication issue, or the patient is in palliative care, has limited life expectancy, or is in hospice, you're going to go down to this section here, tobacco screening not performed. And in here you will have the option to choose an exclusion for why you're unable to ask the patient or counsel the patient today. You can choose medical reason or limited life expectancy. Like other measures, never select no reason specified. Once you have chosen this and you've answered the details, you can close this section. And just like the other option, you're going to verify social history and an exclusion has been sent for this patient. That is the end of this workflow for this measure. Thank you.